57-year-old male with chronic swelling of the posterior elbow, originally over the olecranon, and then it kind of shifted a little bit distally. He's no fever, chills, no trauma. It's not tender to touch. He's had it drained 4 times. The last time being about a month ago. It just came back. He had a cortisone injection about a year ago. That seemed to hold him for about 10 months. The last time it was drained, there was no cortisone injection.
Here we're looking at a sagittal view of this very large fluid collection over the posterior aspect of the proximal forearm. I believe this is an extension of an Olecranon bursitis. As you can see, a little bit of a tract here going up towards the olecranon. So I believe this is an atypical Olecranon bursitis, which you can see here in red, and the triceps tendon is in green. And when he first had this, it was actually a typical Olecranon bursitis. See multiple septations here in this chronic bursitis as it is attempting to organize itself, but he still has a fair amount of compressible fluid within this large cyst. So now we're going to look at this in an axial view. So we can see the humeral shaft. You can see this very large fluid collection again with, seems to have thickened walls consistent with this chronic bursitis. You can appreciate some of the musculature just underneath this bursa. And again, you can appreciate septations within this chronic bursitis. This is the approach. It's an in-plane approach. You can see these bright dots in the fluid here, and that's air from the needle going into this bursitis, and I call that a bubble flash sign, which is basically confirmation that we're in the fluid collection. Here you can see we're draining just about all of this serosanguinous fluid out of this atypical Olecranon bursitis. Here we're doing the cortisone injection after the aspiration. And you can also appreciate a pretty good reverberation artifact underneath the needle.